Thank you, Dr. Chirume. Good afternoon, everyone. I'll be presenting my research with the title Comparing First Trimester Ultrasound Scan Markers and Combined Tests for Aneuploidy Screening and Low Risk. Aneuploidy are chromosomal abnormalities that result in alterations in the number and the structure of chromosomes. And the most common are trisomy 21, 18, and 13. So prenatal screening should be offered to all women for this aneuploidy. Currently in Zimbabwe, there is no national aneuploidy screening protocol, and women are being offered different protocols which are used by practitioners. So the laboratory reported combined tests using a cutoff of 1 in 300 and specialized reported ultrasound scan markers and risk cutoff of 1 in 300. So the establishment of the FME has allowed standard approach of ultrasound-based screening. So currently, screening protocols have not been evaluated in Zimbabwe. So many women are going to pregnancy without screening. That was the problem of the research. Moving on to the aims and objectives, the aim was to compare aneuploidy screening protocols, first trimester ultrasound scan markers, plus combined test, low resource and object were to determine the percentage of fetuses using both ultrasound scan markers and combined tests, and to compare the proportions of screen positive pregnancy both ultrasound scan markers and combined tests. So the research question was, how do the two methods of screening for aneuploidy compare? And the justification for the research was that to provide evidence whether ultrasound-based screening can be used as an alternative when we cannot afford biological markers. Moving on to the methodology, the study was a quantitative cross-sectional retrospective study. It was carried out in Harare, which is led by an FMF certified specialist. The population comprised of women who received both screening protocols, and the inclusion criteria was all for women offered both protocols. Moving on to the exclusion criteria was the multiple pregnancy and those that did not receive both protocols. The sample size for the research was 80 patients. I used a Dupson formula to calculate for that. Then moving on to data collection, there was extraction of data was done from files, coding was done, and then the data was entered into Excel. For analysis, data version 1.5 was and standardized method for the research. Patient confidentiality was observed and ethical clearance was sought from the medical research of Zimbabwe. Moving on to the results, ultrasound screened 98.1% of the population is low risk and 1.9 high risk. Then our combined test screened is high risk, 24% is low risk, and 30% is intermediate. Then comparing the proportions, combined tests more high risk screens as compared to ultrasound, and the amniocentesis was done to find out the outcomes of the diagnosis of the pregnancy. Moving on to the discussion, 98.1% were screened as high risk using ultrasound because the ultrasound scan markers were normal, and the 1.98 had abnormal tricuspid regurgitation. The nasal bone was absent. This concurs with what is Mashizha, which suggests that any combination of the sono markers, the test is considered positive when any of the sono markers is positive. And then the combined, for the combined case, those that were high risk, either HCG form above the expected value or the PAPE form above the expected value. And this similar to what is suggested here, F et al. Suggests that Down syndrome is associated with and in a similar study that was carried out by Check et al. In 70.76% is high risk, and then the NT above the 95 centile, and an explanation to differences from the results that I got in those that were observed by Check is that the population in the study comprised of tests that had Down syndrome, and obviously the NT was above the 95 centile. So our combined screening test more false positive, which was 24, compared to first trimester ultrasound scan markers, which was 1.9, a difference of 1. This concurs also, we showed that combined showed false positive, more false positives as compared to that of ultrasound. And the results of the risk cutoffs that are used for both protocols, ultrasound based for a cutoff of 1 in 100, which minimizes false positive results, and combined to choose a cutoff of 1 in 100, which includes false positive results. So moving on to the conclusion, there is a potential for first trimester ultrasound scan markers for Down syndrome due to its absence of low false positive rates, the accordingly selected centers. And moving on to the limitations of the study, although 80 patients were selected for the study, 54 were used in analysis because they had ultrasound results. So if we get increased sample size, this may help us obtaining accurate results for the study. And also the study included all patients that were high or low risk who had first trimester ultrasound based test, and combined test may have contributed to not be able to determine the detection rate for both protocols. So moving to the recommendations, a study which only includes patients at high risk by either ultrasound or combined test recommended, as this may increase the probability of positive outcomes, which helps in determining the detection rate for protocol. Thank you. Over to you.